All right, so today's listener submitted question is, why does my puppy throw up white foamy froth in the morning? That is a good question. Short answer is, I do not have all the answers for that, but there are some things that you can kind of look into and look for. So that is kind of a broad net. There's a lot of different things that can be going on. I'm not trying to look for the needle in the haystack in some of these cases, more so just the basic, common, straightforward things. So once again, a little bit of a loaded question, fair question, legitimate question. Get questions like it fairly commonly. So thanks for submitting it. The short version of it is, as long as they're eating, drinking, peeing, pooping, and the rest of their behavior is good, I don't generally worry about it. We'll do benign neglect, which means we ignore it. They do it occasionally, not a big deal. I've had a lot of patients where we've done a full workups on those things for, blood work, x-rays, abdominal ultrasounds, even potentially scoping the stomach and not find a problem, and we spend a lot of money doing things. So I tend to be a doctor that's a little more conservative in that aspect. Every owner is different. Some want all the answers and want to cross every T and dot every I. Kind of go about it the real gold standard route. Great way to go. Just gold standard diagnostics has a gold price tag. Some of my clients, that's in their budget. Some of them, it's not. So once again, I usually defer to the actual patient and the clinical signs of the patient. How is the patient feeling, doing? Is it progressively getting worse? Then yes, you should get it seen and checked out. If it's really occasional, and I usually don't worry too much about it. There's various things with gastric reflux. We'll usually put them on a certain medication to slow that down. Some different things we can look into there. But as long as the behavior is good and everything else is good and they're not clinically progressing, I generally play a little more conservative on the workup side of it than swinging for the fence to rule out a bunch of things. But there are some things that you can find in there, from ulcers to foreign bodies that bounce around to GI sensitivities or stomach sensitivities and a whole host of a bunch of different things that I'm not aware exist in my patients. But for the most part, that's what I would do. So hope that helps, guys. Thanks again. Appreciate it. See you next time.